Mr. Johnson. My name's Debbie. I'm going to be your nurse today. Provide for privacy. Do my hand hygiene. I have an order to do a nasotracheal suction to get some of that phlegm out of your throat and your bronchial tubes. I'm going to be checking your oxygen level with my SPO sensor, and I'll be doing a lung assessment first. I'll be taking a sterile tube, and I will be lubing it and inserting it into your nose about 8 inches, and I'll use suction intermittently as I pull it out. So, do you have any questions? At any time, while I'm doing this, raise your hand if you are starting to feel dizzy or need more oxygen, and I will stop and re-oxygenate you. But right before I take your oxygen off, you will take about 3 to 4 deep breaths, and that should oxygenate you enough for me to do this for about 10 seconds at a time, and I will reassess you in between each time. So I'm going to go ahead and get your suction turned on, and it will be between 80 and 120. Let me check that real quick, and it is. I'll also check that with saline. I'll go ahead and assess your lungs, front and back. Laterally, and I'll also listen to 5 places on the back. You go ahead and be taking a few breaths while I get your kit assembled here. Open it away, across, take my gloves out. Go ahead and open my saline, and let me get by the edge, fill this up so that I can rinse my tubing in between. I'm going to open the lube, spread it along the sterile field right here, and I can go ahead and open my gloves now. I also have my yonker here to suction mouth afterwards if needed. Put my glove on. And then this one. Take this out. I'm going to keep it wrapped up in my hand so it doesn't get contaminated. Put this here. And then I will take this hand, my non-dominant, and it's going to be unsterile now. Push this on there. I'm going to check, make sure, and suction, and yes, it's up between 80 and 120. Okay. All right, Mr. Jones, you've taken your 3 breaths. I'm going to go ahead and lube my catheter, 4 inches or so, and I'm going to take your oxygen off. Keep my tube straight, and I'll enter that to about 8 inches, and then I'll do intermittent oxygen. I can do this up to 3 times, and reassess in between each one, re-oxygenating him every between each suctioning technique. I will reassess his oxygen level. I can suction his mouth afterwards if needed, and we're going to listen to his lungs front and back again. sides. And I will listen to the 5 positions on the back side also. I will reposition Mr. Johnson now in a comfort position. Make sure his call light's within reach. Provide for privacy. Make sure his possessions, call light, and everything is. And I'll just start the catheter. I'm gonna record what amount I was able to suction out, how he tolerated, use the 14 French, the color and consistency of anything that I got out. And I will raise my side rail back up, lower the bed back to floor level. And that will be the end of that procedure.